The next most important genodermatosis is the xeroderma pigmentosus. It is an autosomal recessive which is associated with the repair defect of the ultraviolet induced DNA damage. The child is normal at birth, but the diagnosis is suspected when a child has photophobia and freckling before the age of 2 years. We also have one more entity called as pigmented xerodermoid, in which the DNA repair is normal but the synthesis is decreased on exposure to sunlight. So early diagnosis and protection from the UV rays will prevent the cutaneous changes in the xeroderma pigmentosa patient. And these are the patients who have a high chances of developing the squamous cell or basal cell carcinoma in future. So early diagnosis, and by taking the early precautions, it helps in the cancer surveillance. So this is a child who is suffering with xeroderma pigmentosa. Here we can see the presence of freckles and depigmented macules on the face. So such cases should always be evaluated cytogenetically and a repair gene analysis should be confirmed. So here the ultraviolet ray exposure of the cultured chromosomes will show the radial figures. So the prenatal diagnosis by the assessment of UV induced, that is ultraviolet induced DNA repair synthesis from the cultured amniocytes or a chorionic villi is possible. So this is one of the picture, that is the radial figures and the breaks which are shown with the red arrows, which will indicate that the patient is having an ultraviolet induced skin damage, and it also helps us in educating the patient about the sun protection and also the monitoring for future squamous cell carcinoma.